Well, certainly a lot of us talking about Urban Meyer stepping down officially yesterday after the Rose Bowl against Washington on January 1st. You'll hear it here on WAKR. But a lot talking about his health. Let's bring in Dr. Joe Congeni right now and talk about this cyst in his brain.
Yeah, these arachnoid cysts, Ray, they are totally benign growth or a tumor or cancer or anything like that. So it's not something, in fact, in the vast majority of people's symptoms, but it is a cyst like anywhere else in the body, a sac of fluid, and it is in the tissues that surround the brain, or the tissues that surround the brain and the spinal cord. And the brain and spinal cord are bathed in this shock-absorbing fluid called CSF, cerebrospinal fluid. And this fluid is supposed to act like a little bit of a shock absorber for the spinal cord and the brain. And so what happens, though, in some people, 5 to population, is they'll get kind of a pushing out, an outpouching, or a pocket of fluid from this CSF that'll form in the that cover the brain. And most of the time, these arachnoid cysts are around the brain in different areas, and with certain things that we do increase in size. The majority don't cause any symptoms at all, and we pick them up like in one of our concussion patients. We look at an MRI or even a CAT scan in the emergency room for a bad concussion, and you'll see, oh my gosh, that person has a cyst, and they're pretty common, and they usually don't cause if they do cause a problem, if they're progressively getting bigger, the number one problem is headaches, but they could cause they could cause even problems with walking, gait disturbance we call it, a walking problem, something like that. They definitely, though, can have other things going on in your life, like stress or burnout or sleep problems. A lot of times that's what brings these to light. Find that looking actually for other things on MRIs or CAT scans, but they're usually not things that bring patients or athletes into an emergency. And so they are seen a lot at Akron Children's. I talked to our neurosurgeons yesterday and asked them, and we know that if in various circumstances they need to have surgery to be fixed. And in those rare circumstances where they're continuing to contribute to problems, we'll actually sometimes either shunt that fluid, move it to someplace else so it's not causing pressure around the brain. Usually the place they shunt to the abdomen where we have extra space for fluid, or sometimes we do surgery on those. And we know that Urban Meyer actually talked yesterday in his press conference. He had surgery in 2014, but that he had to get some of these things under control. But I think it was also clear in his talk some of the other things he needs to get under control, the issues of the stress and the burnout and the sleep problems and other issues like that. No question, he talked about those too. So an arachnoid cyst, they're not life-threatening at all for him, pretty common in the general population, 5 to 6%. Most of the time we don't have to do anything with them.
Joe, let me ask you this. Certainly the headaches and, the health with the cyst and everything a factor. Is this a type of condition to rest that Urban could come back and coach? I'm not asking you to dive into his personality.
Not at all. Certainly that's a fair question. Thought of very much myself. He's obviously a remarkable coach, a wonderful coach, one of the greats. He's won all 4 places that he's been, so he has a great gift and skill for coaching. But part of doing that, and part of why this stress and pressure is common in this field of coaching, is a lot of these people really drive themselves and push themselves very hard. So a lot of people were running around, gosh, he didn't say exactly what he's going to be doing or anything. Well, what he's going to be doing is getting himself better, decompressing, getting himself better, I would imagine, for a period. If that goes well in the next couple of years, that gift that he has, he's still pretty young at 54. That gift that he has, I think, might present itself in a year or 2 or 3 of doing something less anxiety-provoking. I think he might find himself in 3 or 4 years that may be something like this, or whatever period of time. But I think that's a fair question. I think he didn't totally close the book on that at all.